Hello, I'm Dr. Melissa Congdon and I have fibromyalgia. I chose to become a fibromyalgia consultant after suffering from severe fibromyalgia symptoms and then getting dramatically better once I found the treatments that work for me. The following is what I share with all of my new fibromyalgia patients. Here is a summary of fibromyalgia and what I have learned about how you can feel better. Here's a patient's guide to fibromyalgia. So what is fibromyalgia? Fibromyalgia is a chronic pain syndrome of the muscles, tendons, and ligaments. There's no joint involvement, there's no inflammation, it's not autoimmune, and all lab tests are normal. University of Cincinnati researchers have found an area on chromosome 17 that codes for the disorder. Fibromyalgia is very common. At least 3 to 8% of people have fibromyalgia. Boys and men can have fibromyalgia. Girls and women can have fibromyalgia. Chronic widespread pain is the hallmark of the syndrome, but some of us have more fatigue than pain. Almost all of us have non-restorative sleep. In fact, after seeing hundreds of fibromyalgia patients over the past 7 years, I've come to understand that chronic widespread pain and non-restorative sleep equals fibromyalgia unless proven otherwise. So I'm trying to teach healthcare providers to talk to their chronic pain patients and ask them about their sleep. In fact, they should ask you, when was the last time you awoke feeling rested? If that's been a very long time, or if you only rarely awake feeling rested, then you could have fibromyalgia. Many studies have been done which indicate that fibromyalgia patients have unique physical findings and unique biochemical findings. Functional MRI results, SPECT scan results showing decreased brain flow in certain areas, neurotransmitter differences in our spinal fluid, and cytokine, which are immune protein levels, are different in fibromyalgia patients. There are hundreds of studies that show that fibromyalgia patients have unique biochemical findings, helping us to know that fibromyalgia is a real syndrome. Research is ongoing at the City of Hope and many other research centers. On my fibromyalgia page, Melissa Congdon, MD, Fibromyalgia Medicine for Children and Adults, I highlight new studies as they come out. How can I tell for sure if you have fibromyalgia? Well, I can tell on physical exam, and no, not the inaccurate tender point exam. In a big study, the tender point exam was found to miss 25% of known fibromyalgia patients who had been diagnosed with fibromyalgia by their rheumatologist. Now, I was taught how to do the mapping examination by Dr. Paul St. Amand. He found that everyone with fibromyalgia has a distinct pattern of small swellings in their muscles, tendons, and ligaments. And everyone with fibromyalgia has small swellings of their left anterior thigh. Most people with fibromyalgia don't even realize they have these swellings. And the swellings of the thigh usually don't hurt, but it's very easy for healthcare practitioners who've learned the mapping exam to know if fibromyalgia patients have these swellings. If I'm examining you and I find that you do not have anterior thigh nodules in your left thigh, then you do not have fibromyalgia, and your primary care provider needs to find another cause for your chronic widespread pain, such as a syndrome like celiac disease or thyroid disease. I have found that there are 5 game changers in fibromyalgia recovery. The first is eating foods that help you feel well. Now, for some people that can be drinking less caffeine, some people that can be eating less sugar. For 30 to 40% of fibromyalgia patients, they feel dramatically better on a low carbohydrate diet. Dr. Paul St. Amand has developed a specific food plan for people with fibromyalgia who have fluctuating blood sugar. There are more details about the low carbohydrate diet and the dramatic improvement in symptoms you can feel in one of my other YouTube videos. Number 2, consistent aerobic exercise. I teach my patients how to slowly and carefully get into shape so they don't crash, but they build new mitochondria over time, which gives them more energy, more stable mood, better sleep, and more strength. I have not met anyone with fibromyalgia who feels well unless they get consistent aerobic exercise. Number 3 is making good progress on the guaifenesin protocol. The standard therapy for people with fibromyalgia is to prescribe pharmaceuticals which mask the symptoms and don't get to the underlying driver of fibromyalgia. I have found the guaifenesin protocol to be extremely effective in many of my fibromyalgia patients. I go into detail about the guaifenesin protocol in another one of my videos. Number 4 is proper hydration. It's vital for all of us with fibromyalgia to make sure we are well hydrated during the day. We have a cellular defect which makes it hard for our body to produce energy. And if we're dehydrated, it makes it even more difficult for our body to work well. And the 5th game changer for fibromyalgia recovery is to use mind-body therapies to help the parasympathetic nervous system be in balance with the sympathetic nervous system. This helps us get better sleep, be less anxious, more relaxed, and feel better in general. If you would like a new patient fibromyalgia evaluation, including the mapping exam, both Dr. Paul St. Amand and I are taking new patients. Dr. Paul St. Amand is in the Los Angeles area. I have 2 offices, both in San Francisco and north of San Francisco, and our contact information is following.